All
Hi,
right.
everyone. It is a little after 2, so I'm going to go ahead and kick us off. Today might be a little bit shorter than typical. We probably won't use the full hour. But today's statewide Zoom is going to be about the disability policy seminar, which was held in Washington, D.C. last week. Shawn, Fulton, and Melody Cooper, who are both on this call, were both present for that. So they're going to share a little bit about their experience. And then Shawn's going to be talking about some of the public policy priorities of the Arc of the United States. So I'm going to go ahead. I'm going to hand it over to Mel first because I know Mel has to duck out in about 30 minutes for another meeting that she has. So Mel, would you kind of get us started by telling everyone what the Disability Policy Seminar is and then your experience last week in DC?
Okay, sure. Thank you, Becky. Hi, everybody. Welcome to the Statewide Zoom. I am Melody Cooper, and I've been around since Africa for a long time. And everything about this time we go up to DC is one of the amazing opportunities that I think as an advocacy we get to do, because not only we take the Indiana folks, we get to meet other advocacies, and we talk to people, and we advocate for what it's worth. And we stay this year at the Western downtown DC, and there was 900 people in one this big old room. Can you imagine? But every one of them had ideas. We talked about Medicaid. We talked about Social Security, the benefits. We had 2 good days of just speakers. I mean, some amazing, amazing speakers talking. People with disabilities and people without disabilities talking about Medicaid and what they want to see and how they want to see it happen. And then Tuesday, for the last 2 hours or 3 hours, we broke out into breakout sessions and we talked about things that we want to see. The biggest thing was that I took away from this whole thing was Medicaid. I mean, I did not. I knew before we left that Medicaid was going to be a big priority, but when we got to DC, walked in that room Monday morning, that particular Monday morning, it was like Medicaid, boom. And there were people talking about rallies. They want us to do rallies for us with the governor, and we talked about that. And then also we just talked a lot about what we felt and how we felt. We had people that had microphones. Microphones was actually going around the room, and people had questions and answers. And then that Wednesday, we spent all day from about 9 to about 2 up on the hill talking about what you see and what you really understood and how it affected you, what you thought about it, what you seen. And I mean, it really was to me an amazing time. But Medicaid is amazing. I mean, it's amazing. We talked to our legislators there. I don't think we got to really speak to them like the legislators directly, but we got a chance to speak to their aides. And we told the aides what we thought and how we felt. So to me, it was an amazing time. I really enjoyed it. Knowing Shawn was along with, and I think they had a good time. But I mean, this is about my 13 times going since I have been with the art, and I love it each and every time. So yeah. So now I'm gonna turn it over to Shawn, and I guess he gonna finish this off. Shawn.
Okay, thanks, Mel, for your um, perspective on the disability policy seminar. Um, so my perspective of the disability policy seminar was just like Mel's, basically all about Medicaid and SSI and, just benefits in general. Um, so well, Noah and I got to do something really cool. We got to open the conference on to be on a panel to discuss how the new people that was just new to the conference, uh, we were talking to them about how to make sure you know everything that you need to know before you go on the hill. And Becky, if I'm right, I think there were about 300 people there that was their first time. At least that's what it looked like when they all raised their hand. Um, oh, go ahead.
Yeah, so there were over 900 folks who attended disability policy seminar in DC this year from all across the country. And I think they said over 300, it was their first time. So we were really excited to have so many new folks who were getting engaged in the public policy process and really sharing their thoughts and input with their elected officials.
Yeah, and so we were actually at capacity. People were asking for chairs, and then they had to come and tell everybody that they couldn't bring chairs. Um, More chairs into the room because they were at capacity and the fire marshal wouldn't allow that. So that's actually a really good thing to have happen, be at capacity at one motel where you can't have any more people come in. Um, but yeah, Noah and I would have liked to have been fine. Oh yeah, what we can talk about that, Lexi. Um, let's see, and then Becky and I, we are doing this DSP um, program right now for with 3 different providers. And so Becky and I thought it would be really good to go to the DSP track, that the session that we went to. And so um, I think it was might have been too high level for me, but Becky, you want to explain it?
Sure. So Shawn and I attended a breakout session, which Mel had kind of mentioned what the breakout sessions were earlier when she was talking. And it was all about the DSP crisis. And first of all, when we say DSP, that means direct support professional. So those are those people in your life who provide you care and support so that you're able to live your best life out in the community. And the presenting person was someone from NADSP, which is the National Association of Direct Support Professionals. And they were just talking about why it is so hard to find good care providers in our country right now. There's something called the DSP crisis, which I'm sure for a lot of you who receive services or go to a day program, or I think we have some folks who are DSPs on this call, you know that direct support professionals have a really high turnover rate, which means they don't stay in the job for a very long time, and that places are always looking for more. They're always hiring more DSPs because the demand for that really great personalized care for folks with disabilities is very high. And right now, we don't have the workforce to meet that demand. And what I really appreciated about that session was that the panelists were all people who were direct support workers. So they were talking about the benefits of being a direct support worker, talking about how rewarding that work can be, and also talking about creative solutions to increase that workforce. So obviously, when we're talking about trying to attract more direct support workers, we're always saying, well, first of all, we need to pay them more, and kind of advocating for increases so that direct support workers can be paid a fair and living wage for the incredible work they do, but also talking about the possibility of taking folks with disabilities, folks who might even have their own DSPs, but training them to be DSPs for others, to provide that support and peer mentorship to other folks. So Shawn briefly mentioned the project that he and I are working on, which is actually a curriculum to train folks with disabilities, how to become DSPs and how to provide that service. So Shawn and I really enjoyed it. I was glad Shawn and I were able to attend that session. But Shawn, if you want to talk maybe a little bit more about your experience on the Hill, and when we say the Hill, what we're referring to is Capitol Hill. So that is where Congress meets. So in Washington, D.C., we have senators and representatives. And we went and visited with Mel had mentioned the visits that we were in. We didn't get to meet any of our senators or representatives directly. We got to meet with their legislative aides, their director of public policy, things like that, to share our concerns and the priorities of self advocates in Indiana, and to ask our senators and representatives to make voting choices that support folks with disabilities. But Shawn, if you want to share a little bit about your experience on the Hill, and then you can talk a little bit about what those public policy priorities we were discussing were.
Okay, yeah. So my experience on the Hill, um, I'm not like Mel. I haven't been there like 15 times, but um, I've been there a few times to the Hill. Every time it's been a pretty good experience. This time, a couple people had said that they had checked out the ARC and like what the ARC stands for and what we do. And so we got to go to, well, actually, Becky's poor body, she's probably like really tired and sore because she stood in line waiting to get into the Hoosier Huddle where we would have actually met with our legislators from DC. But Becky was in line for an hour and a half, and we still didn't get to go in and meet our legislators because we had to go to a meeting with Victoria Sparks, legislative assistant. And
All page, meeting chat. Format 1 of 5. Message site statewide Zoom edit. Space E V E S space G E space O space S I E space D O W F space I F space L I N E space L O L. Enter.
Lexi.
Hey Lex, you're unmuted. Are you waiting to talk, or is your
Oh, I'm sorry. I didn't know I was unmuted. I'm so
Yep.
sorry.
No worries.
I think I hit a key command by accident.
No worries.
Chat messages history. Control.
Yeah, I stopped because I thought you were going to talk, but okay. But yeah, we met with every person that we met with was their legislative assistant, and they were saying that the legislators are not wanting to cut Medicaid. They just want to get rid of fraud or whatever the heck it was. But they were listening to us, they were agreeing with us, they were writing stuff down. We gave them folders with everything from actual stories, Medicaid stories from people with disabilities, and the ARC flyers and some other stuff. And so it was actually a really good experience because I feel that they actually listened to us and took our concerns back to the actual legislators. So I thought it was really good day. It was a long day. It was like an 11-hour day for us four, but it was a really good day. Talking to them and letting them know that how people with disabilities need Medicaid and the benefits that we have. Okay, so on to some of the policy issues. Medicaid is a joint federal and state program that provides health insurance and long-term care to more than 1 in 5 people. It is a very important source of coverage for millions of people with disabilities. The budget resolution passed by the House directs the House Energy and Commerce Committee, try and say that like 5 times, which oversees Medicaid, to cut $880 billion over 10 years. Ask your members of Congress to reject any effort to block grants, cap or cut federal spending in Medicaid. Ask Congress to oppose work requirements in the Medicaid program. The Individuals with Disability Education Act, IDEA, is a federal act that supports students with disabilities and their right to free, appropriate public education. If you had an IEP, individual education program, is in school, you benefited from IDEA. Ask Congress to fully fund IDEA, end harmful restraint and seclusion practices. Man. Oppose law that reduce the right of children with disabilities to secure a free, appropriate public education. Ensure that accommodations for students with disabilities in higher education are available to meet the needs of the students.
And if it's all right, I just want to add something here about the restraint and seclusion practices. So, what we see sometimes in schools, specifically with special education, is if a student is having high support needs or exhibiting what a lot of times folks call behaviors, which, in my opinion, is just them communicating that their needs aren't being met, we'll see them being restrained or secluded. So, maybe if someone is having a difficult time getting their needs met and supported and starts acting in a way that the teacher doesn't like, they might send them to a sensory room, which is really just a way to get them out of the classroom and out of their hair. So, really, what we're talking about when we talk about harmful restraint and seclusion practices is making sure that those students with disabilities are supported appropriately and that we're not using sensory rooms or timeouts as a punishment, but really only providing them when they're necessary. And Lexi, it looks like you have your hand up if you want to come off mute and ask a question.
Yeah, so I don't know how many of you 90s babies or earlier or a little after spent quite a bit of time in the hallway, because I did. So I wonder if this also like keeps teachers from being like, we're putting your desk in the hallway or you gotta go sit in the hallway, because that was a big one. My generation is if you were disrupting in class, they made you sit in the hallway.
Yeah, I don't think that's just a 90s thing. I think that's an all the time thing, because I'm not from the 90s. I'm from the 70s, but in junior high and some of high school, had to sit in the hallway.
I feel that. I also had to go sit in the health center. When I was in high school, I had to go sit in the health center a lot. And then sometimes they would send me home. I went to a residential school, so if they sent me home on like Monday, if I had behavior on Monday, They sent me home. I didn't go back till the following Monday. 'Cause I went to a residential school like 2.5 hours from my house. They sent me home a lot. Like one time I got suspended and then I came back and then they put me on what they called medical leave, but it was basically like kicking me out for the rest of the school year. But I didn't have to do homework and they just gave me the grades that I had before they put me on quote unquote medical leave.
Thank you for sharing that, Lexi. And to me, that sounds like you weren't getting the appropriate accommodations, right? And that they were using those seclusion practices, sticking you in the hall, sending you to the medical, I can't remember what you called it, the med area, the nurse's office, whatever it might be. That was just a way for the teacher to not have to give you the accommodations you need. And so really when we're talking about seclusion and restraint, that's what we're talking about there. So great examples.
Yeah, and also like how you have the right to stay in school till you're 22, but my school kept trying to graduate me and me and my mom wanted me to stay and get life skills. And every year in my case conference, it was like 3-part 6-hour case conference just for us to fight for me to be able to stay till what the law said I can till I was 22.
Okay, well, that sounds crazy. Well, sorry that that stuff happened to you. Let's see. Disability funding. The Developmental Disability Assistance and Bill of Rights Act of 2000 DD Act created programs that work together to support the needs of people with disabilities. The state DD councils, protection and advocacy systems, and the University Centers on Excellence in Developmental Disabilities, IIDC. SAI receives funding from the Governor's Planning Council because of the DD Act. Ask Congress to fully fund the DD Act and secure or ensure that the budgets and opportunity or appropriations law provide adequate funding that supports people with disabilities in their communities.
And then just to tag on to this one too. So every state in America has a DD council. So in Indiana, that's GCPD, the Governor's Council for People with Disabilities. They all have a protection and advocacy system, which is a system to protect and advocate for folks with disabilities in Indiana. That's IDR, Indiana Disability Rights. And then, like Shawn mentioned, the University Centers for Excellence in Developmental Disabilities in Indiana is IIDC, which is the Indiana Institute on Disability and Community. So a lot of those programs are things that folks with disabilities in Indiana benefit from greatly. You all are on this Zoom call because Self Advocates of Indiana has the support and the funding to do these types of Zoom calls because of the Governor's Council for People with Disabilities, because of the DD Act. So we want to be sure that these programs continue to be funded so that folks with disabilities have the supports they need to live and thrive in their communities. Lexi, you've got your hand up.
Audio now unmuted.
Yeah, I wanted to add, so a lot of these state agencies that support our community, like most of them have Facebook pages and some of them have newsletters. Like I get the IIDC and CCLC, which is Center on Community Living and Careers, through IIDC. I get their newsletters and like their events and stuff. A lot of it, like there's some of it that's like for providers, They also do like family employment awareness training. So it's mostly for like um, families of individuals transitioning from high school. And usually in those trainings, it's like I speak at a lot of them. So it's usually like me representing SAI or somebody representing SAI. There's usually someone from the Arcmaster Trust, sometimes Able Account, sometimes PPL, which is like the agency that's doing self-direction for the health and wellness waiver, and pathways, and TBI, I think too. So it's like there's a lot of opportunities. I know Governor's Council sometimes does like, I don't know, like some virtual things. I haven't been on them before. Also, but also INAPSI does a um I forget what it's called, but it's like a virtual thing that's usually on the same day as our statewide Zooms. INAPSI is the Indiana Association of Persons Supporting Employment. So, yeah, if you like follow like vocational rehab and beads and like all them like on Facebook and like visit websites and sign up for newsletters, it keeps you really informed, and it even gives you like webinars you can attend, and things like that.
Thank you so much, Lexi. So I'm just catching up with the chat. Lexi, those were a lot of really great suggestions for kind of other places to look for support and information. Christina asked in the chat if anyone takes notes during these and if they are sent out. Christina, we do send out the slides after these calls. And if you are interested in kind of that list of folks to follow on social media and newsletters you can sign up for, we can also include that when we send out the slides with the recording. There is a recording that will be available on the Self Advocates of Indiana YouTube page as well. So if you ever are trying to remember something that was said in one of these calls, you can always go back and rewatch as well. And then Lexi had a really great question in the chat as well, asking if the Governor's Planning Council was the same thing as GCPD, the Governor's Council for People with Disabilities. Yes, that is the same thing. I'm going to lovingly tease Shawn and say that's him showing his age. Before they rebranded to the Governor's Council for People with Disabilities, they were known as the Governor's Planning Council. So when you have folks who have been in the advocacy space in Indiana for a while, talking about the DD Council in Indiana, you will sometimes hear them refer to it as the Governor's Planning Council or GPC. It's just kind of a habit that's hard to break. So great questions. And so the last thing we wanted to talk about today, you know, Shawn and Mel had the awesome opportunity to go on the Hill to meet with folks from the offices of our senators and representatives, but you also have the ability to make your voice heard. You have the ability to reach out to your elected officials. They're your elected officials. They represent you. And so it's really important that you do make your voice heard and let them know what you're thinking. And there is a website here. It's iga.in.gov/information/find legislators. It's very simple. I'll pull out that link and put it in the chat once I'm done speaking. I'm not great at multitasking today. But you just put in your address and it will pull up who your state level elected officials are, as well as your federal level. So we'll all have the same 2 senators because we are all in the state of Indiana, but based on where you live in the state of Indiana, you will have different representatives. So you can use that information. It'll include a phone number. You can also go to your elected officials website. They usually will have a contact me form or an email address that you can send your thoughts to. And when you're doing that, when you're reaching out to your elected officials, always be polite and respectful. That's the best way to get folks to listen to you. And be brief. They have a lot of constituents, a lot of people who they represent. And so try to keep it to, a brief phone call, just a couple paragraphs, but don't be afraid to make it personal. So don't be afraid to say, my name is so and so. I live in your district. I use the Medicaid waiver to attend my day program, which teaches me social skills and allows me to see my friends. Then you tell them what you want. So you would say, please don't vote for any cuts to Medicaid so that I can keep my services. Thank them for your time. So say, thank you for listening. And then I always like to kind of offer myself as a resource too. So let them know, if you ever have any questions about a bill about Medicaid, if you ever want to learn more about my experience with Medicaid, don't be afraid to reach out to me. So that's kind of our tips and advice for when you're reaching out to your legislators. And Shawn, you've got your hand up. Do you want to share a little bit more about that?
Yeah, I just wanted to tell everybody, if you guys email them, they will email you back personally. I have emailed my legislators a lot, and they send you back an email thanking you and telling them what they tell you what uh, they're passionate about and that they will help you with the disability stuff. So they will email you back just to let you know.
That's a really good point, Shawn. And thank you for bringing that up because that does remind me. If you do decide to call your representative, um, it's not going to be the representative who answers the phone, right? If you're calling Senator Young, he's not going to answer the phone and say, "Hi, this is Senator Young." It's most often going to be a legislative aide. And they will ask for your first and last name. And then they also will ask for contact information. So they typically ask for your home address. They do that to make sure that you live in their district, that you really are a constituent, someone who they're elected to represent. But then, like Shawn said, you usually do get a letter afterwards thanking you for voicing your concerns, thanking you for reaching out. And then usually they do include information about how they ultimately decided to vote if there's a specific bill that you were calling to talk to them about. And then they also do sometimes ask for your email address. I would say it's about 50-50. Sometimes they do ask for my email address when I call. Sometimes they just ask for my address, but you typically can expect to receive some sort of communication from them after you call. Lexi, you've got your hand up.
Olga, audio now unmuted.
Um,
Why? Hand.
so, somebody at church last weekend made a comment basically, against trans rights. And I wanted to know if, like, because there's a really large, like, population of intersectionality with the autism community and being non-binary or transgender. And I wondered if because of like the intersectionality being such a common thing between the autism community and like transgender or non-binary or just LGBTQ plus community in general. So I wanted to know if that was brought up at all in the policy seminar, because I don't know much of what's going on about it, but I do know there are some people that want those rights to be on the chopping block, and that's not fair. So it's not right. So I was just curious, like, if that was talked about at all, or if anybody knows, like, basically if LGBTQ plus rights are on the chopping block, because I don't follow politics like that because I'll go crazy, basically.
Yeah, great question, Lexi. Thank you for asking that. They did briefly talk about actually, I wouldn't say briefly. There were discussions about intersectionality at the conference. There were some panelists who identified as trans who were non-binary or gender non-conforming. So certainly that intersectionality did have a place of representation at the public policy seminar. I would not say that it was the primary focus of the public policy seminar this year. They really were focusing on those three main public policy issues of making sure there are no cuts to Medicaid, making sure that IDEA, the Individuals with Disabilities Education Act, remains fully funded and supported, and then also that disability funding, talking about that trifecta of the DD councils, the protection and advocacy organizations, and the university centers on excellence in disability. Well, we still have some time for questions. Thank you for joining us and listening today. I think we've mentioned this a few times in this presentation, but this is supported by the Indiana Governor's Council for People with Disabilities. If you would like to, we would really appreciate it if you could scan that QR code that's on your screen, or here in a minute, I'm going to drop something in the chat, a link to take you to a satisfaction survey, just to let us know if you enjoyed the presentation today, if there's anything that you would like to see different, anything we can work to improve. Having these survey results really helps self-advocates of Indiana to show to our funder, the Governor's Council for People with Disabilities, that we're using their funds wisely and helping educate and support folks with disabilities in Indiana. So I'm going to leave that up there for now. I'm going to go ahead and turn off the recording. Thank you everyone for attending. And then for these last, 20 minutes or so, if you all want to share updates in your life, I'm going to go ahead and put the links that I said in the chat. But this is now your time to socialize and share what's going on in your self-advocacy groups.